Well, I'm very pleased to welcome our plenary speaker, Dr. Bobby Mukkamala. He is a son of Michigan. He graduated from the University of Michigan Medical School, and after Go Blue, after residency at Loyola in Chicago, he returned to his hometown of Flint, Michigan, which I'm very excited to hear about some of his commitment to that town and the work he's doing there. He's an otolaryngologist and has opened a solo practice in his hometown of Flint, Michigan, where he practices alongside his wife, an OBGYN. He's the father of twin boys, and has been since his residency a leader within the AMA. And in June of 2025, he was elected president of the AMA. So please join me in welcoming Dr. Bobby Mukkamala. So I want to start with something personal. We're both of us have parents who are from India. Mm-hmm. I think we're about the same age. And I think if you're from our generation and your parents came from India, you had two career choices. You could be a doctor or you could be a doctor.
That's pretty much it.
And I went to college dutifully, pursued a biology degree. And then when I, about halfway through, told my parents, probably a lot of the colleagues here don't know this, that I wasn't going to pursue medicine, but instead journalism, it was like I had said, I'm going to live in the streets and take heroin for all my life. I mean, it was such a disappointment to them, until I won the Pulitzer Prize. Then they had supported me the whole time.
There you go, exactly.
But I would love to hear your story about journalism that you shared with me.
Oh my gosh, there's a lot of overlap with a different ending. So my parents, they're both retired physicians now. My dad's a radiologist, my mom's a pediatrician. And they moved to the US when they were 25, and they were both medical school in India, and they did their residencies here in the US. And fast forward to when I was about to graduate from high school, so 1987, they had been here for almost 2 decades, and that was their formula for happiness, a wonderful career, financial stability after moving here with a handful of rupees and nothing else. And so that was their path. And around junior year in high school, this was, evening news before 24-hour news with CNN and Fox and MSNBC. We were hooked on ABC, Peter Jennings. Every night we'd watch local news, and then we'd watch ABC and Peter Jennings. And I was like, I want to be like Peter Jennings. I mean, it was an amazing moment for me. And I thought my parents would be like, oh yeah, this guy's awesome. We want you to be Bobby Jennings. Not quite that way, but not their reaction at all. So this is junior year in high school, and I basically got grounded as a junior in high school until I changed my mind. So I didn't get to go to homecoming that year. I didn't get to go to Sadie Hawkins, no prom. And basically at 3 o'clock, if I wasn't on the bus coming home, there was some punishment there. And then University of Michigan has one of these 7-year programs where you apply from high school and you get into medical school. So when I got into that program, then I had a decision to make. One, this is exactly what my parents wanted. I would keep getting my weekly allowance if I went to medical school. Not quite like that, but sort of like that. And I was guaranteed admission into medical school. It was somewhat of a competitive program. So I was essentially like, fine, Mom and Dad, I'll go to medical school. Which, it's quite odd to me that a guy with that history of how they ended up pursuing a career in healthcare happens to be president of the American Medical Association. It seems quite goofy, but somebody had a plan.
Well, I think our field's lost, but medicine's gained.
I don't know about that. I mean, you guys have my dream job. Go figure.
So, in November of 2024, you were 6 months away. You knew you were ascending to be president of AMA, and you were, as they do, giving speeches and going around the country. Can you tell me about that day and that speech you gave, and just tell us the whole story? I think many have probably read about this incredible experience, but it may be new to some people here in the room.
Yeah, so this was our interim meeting. So the AMA meets twice a year with everybody, and that's one in June and one in November. And so it was November, and we were in Orlando. And you're right, 6 months before that, I had been elected president-elect, and so this was kind of my my practice lap around before I got inaugurated as president 6 months after that. And I was giving a speech to people that have known me for more than a decade, right? So they've all heard me speak before. I mean, they heard me speak well enough that they decided that I should be president and they elected me. So they knew me well. And so I was giving a talk to the minority affairs section, just an update about what I had done so far. And I had my iPad and I was at the podium and all of a sudden, like, I lost track of the words. And, I was kind of, like that, talking like that, like not figuring out where I was. And I thought it was like a iPad malfunction, like I got to the wrong screen. I'm trying to find the right screen so I can resume. And they knew that that was not the explanation, right? Because they've heard me speak before. And so somebody stood up and they're like, Bobby, we can't understand you. You're not making any sense. And I was like, yeah, by then, it was like 60 seconds, maybe 2 minutes tops. And then everything was back to normal. So then I finished and I went to the next room and I gave another presentation to a different council. And that went great and they clapped. And then immediately my phone starts blowing up. And it's my wife and the chair of our board. In fact, Mike Sook was here the other day. He was the chair of our board at the time. And they were like, where are you? And I told him I'm right outside this room. Don't go anywhere, we're coming. And I thought I had said something stupid, I had really screwed up, and I was coming to be punished by the chair of the board. But no, they had gotten wind of the fact that Bobby just spoke to us and he didn't make any sense. So they come and they were like, you totally messed up. I mean, did something happen? I was like, no, my iPad malfunctioned. They're like, no, it was something else. And my wife basically said, we're going to the emergency room. So we go to an urgent care. I kind of talked her down. I was like, you know what, I just need my vitals checked. Let's just go to the urgent care. It's going to be faster. Just skipping forward a little bit, like immediately at that moment, essentially I was a patient, right? From president-elect of the AMA, and then 5 minutes later, a patient that people are worried about that had a stroke, and immediately began navigating the healthcare system. Which emergency department is close by, right? Did I bring my insurance card? What's going to happen? I mean, thinking about, what's going on up here, but also thinking about, okay, well, how much is this going to cost, right? And so we went to an urgent care, and I go there, and my wife is with me, and they check all the vitals, because at that time, everyone thought, okay, maybe a stroke. And all the vitals were totally fine. Blood pressure, EKG, all this stuff. But what was interesting about that moment also was that there was no physician there. It was a nurse practitioner, and she did everything that I mentioned, and then basically opened up the chart, handed it to me, and said, what do you think? Right? And then, another sort of moment was, if it was somebody that had some more emergency training to be able to tell the difference between a TIA and a stroke and interpret this, I would have a little more confidence. But anyway, so there I was. Everything looked great. And, I ran it by some cardiologist friends of mine, and they said, okay, maybe it was a TIA. Just when you get home, see somebody, get an MRI scan, we'll go from there. So this is on Saturday. Everything else went fine, main stage like this, talking to, 1,000 people, no other problems. Tuesday, we get home, plane lands, we get home, I drop Nita off, go in to put my luggage in. Immediately, my wife Nita starts going through all the refrigerator and cabinets, getting rid of all our junk food. Everything, right? High salt, high sugar, all this stuff, going in the garbage because Bobby had a stroke, right? At least that was the general consensus. And I couldn't say anything because I didn't have any proof one way or the other. So a friend of mine is a neurosurgeon, and his office is, a few minutes from where we live. And I texted him, I was like, hey, this is what happened. He's like, come on in, our last scan today is at 9 p.m. And it was right around that time, so I went there and I got my MRI scan. Immediately again, access to an MRI scan within an hour of coming home from something that might have been a problem. Just incredible. And so I get my MRI scan, and then it was the tech and I, and we're looking at the images as they come up. And the first thing I saw was, it looked normal, from here to here, and then all of a sudden I see this little white spot in my left temporal lobe. And for a second I thought it was something on the monitor. So literally, like, I'm taking my shirt and I'm wiping the screen, But then you click, and then this little spot is getting bigger and bigger. And it ended up total size of 8 centimeters, which is pretty big. And it was just basically this spot, this big thing. And I didn't know if it was going to be just fluid or a meningioma. I mean, I kind of knew subconsciously that neither of these was it, but that hope, like, maybe it's not so bad. My dad's a radiologist, retired now, so I get him on a WhatsApp call. He's in India at the time. And my wife and I both run a lot of images by my dad because he's a radiologist. He's very good at what he does. And so he's looking at it and he's like, oh, something's wrong with this patient. You know, he's got a brain tumor. And I didn't say anything. And then he looked at the name, just silence. And he's like, let me call you back. And he just had to, and he's like Spock, you know, like no emotion about anything. And literally now within 60 seconds, he sees that his son has a brain tumor. So he called me back about 2 minutes later. By that time, I'm almost pulling in my driveway, and he's on the WhatsApp call. I walk in, and again, this is a confession. I can be stupid. And all I could think of is that moment was, Nita, get that chocolate and potato chips out of the trash. I didn't have a stroke, I got a brain tumor. And she was like, what? And you know, and I'm also a little bit Spock. Like, I don't want to explain it to my mom, who was somewhere else in India, and for my dad, and we have twin boys. I didn't want to have like 5 different calls, so I put them all on this WhatsApp group call, and I'm sitting at the computer. And there's one more thing: I couldn't get that MRI scan digitally. I mean, that should be the standard now, right? But that data is not portable, and their USB drive wasn't working. And I didn't bring a blank CD for the CD thing. This was, I mean, I literally talk about it like this was Fred Flintstone time, and yet we're at George Jetson time, and that we have this amazing surgical stuff we can do. So I ended up taking pictures with my phone of each image as I'm scrolling, and then I'm showing it to my whole family. And, you know, that's when everything started, right? From, you know, the evening of emotion, like, what do we do? And again, this is a confession, being more like Spock than Kirk. I don't know if you guys are into Star Trek. Obviously, I'm a Star Trek kind of nerd. That I was all about, what do we do next? Within an hour of knowing I have a big brain tumor, the future could be miserable, but what are we going to do next? Not the misery of it, but what's the next plan? Where am I going to get my MRI with contrast tomorrow, et cetera? And then it was off to the races.
It's amazing. We've had a lot of sessions about access to health care, insurance denials,
Yep.
but you were on the phone with 9 neurosurgeons, right, within a few
Within a
hours
week?
or a day.
Yep. We, and again, this is telemedicine. And another amazing intersection, because this is a main priority of the American Medical Association, is access to that kind of care where I don't have to fly to 6 different neurosurgeons from California to New York to Texas. I can do that all in my den with my entire family behind me without having to book tickets or get a hotel room. And within a week, had the opinions of people that specialize, not just neurosurgeons, but that specialize in glioma, which is what the consensus was that this looks like, and come up with a plan in a week. And so we decided, after listening, and you know, it's 8 centimeter tumor in the medial temporal lobe, not the easiest thing to get out, right? And everybody was talking about going through a craniotomy twice, anterior approach, get what we can get out, posterior approach, get the rest out. I mean, big stuff. Yeah. But we happen to have an opinion from a guy at Mayo Clinic, Dr. Ian Parney, who said that he could get, you know, the goal was to get 90% of it out. There was too much of it in a dangerous space to go after and not make it off the table. So the consensus was in my whole family, they're like, and at that moment, I decided that I wasn't going to have any input. I didn't have any preference on where I went because, it sounds goofy, but if something happened to me, I'm the one to blame. And I didn't want to be the one to blame. So I let my parents decide, and my wife and my kids decide, and they picked Ian Parney at Mayo Clinic. And again, an amazing intersection, that Ian Parney is an international medical graduate. Right, from Canada, that wouldn't be here were it not for an H-1B visa that he had. And then all of a sudden, in the year of my presidency, if he wanted to come now, somebody's got to come up with $100,000 to get him here to do his training. And so every moment of this, and there's even more, like the treatment of this, I don't know if we're going to talk about this, but the NIH funded research to come up with the pill, the IDH inhibitor, that might make me live longer than the expectancy of 10 years. If you Google grade 2 astrocytoma, which is what it ended up being, life expectancy is 10 years. Because of this pill, it could be longer than anybody even knows, right? I might live as long as I'm supposed to live.
Yeah.
But that wouldn't have been possible without NIH funding,
Right.
which right then, a month after my surgery, NIH funding was going to be cut by the federal government.
We'll definitely talk about that.
Okay,
I
all right.
have some questions about
So
it.
much to say.
But before we get to this drug, which sounds amazing, tell me a little about the surgery. I know you mentioned that, now you're fully a patient. You're kind of going towards helplessness, but your medical knowledge was actually like a little bit of a burden to you?
It could have been for sure, right? And I knew that immediately. Like I could want to know the details of everything, right? Like, where exactly are you going to cut, over what muscle, what are you going to do with the temporalis muscle, where are these, incisions going to be, where are you going to drill these holes, like all that stuff that as a head and neck surgeon, we do that routinely when somebody has a facial trauma or an acoustic neuroma. We combine our work with a neurosurgeon, so that level of detail. But I decided almost immediately, the day of surgery, I just want to be a patient, right? I trust everybody who's taking care of me, and I'm not going to second guess them on anything. And what leads you to second guessing? When you know a little too much, right? And I see that all the time when patients come in to see me that are physicians, but I just didn't want to mentally deal with that, right? My parents were there, my kids were there, my wife in pre-op holding, and I'm in a gown, and I use a picture of that in my presentations, just as the president of the AMA, literally in his gown on the way to surgery. I just wanted to be a patient, and that was enormously helpful.
Yeah. And back to the drug you were taking, we had a session with Miranda Yaver about insurance denials, and we write about people that struggle to get even basic things approved. And your drug seemed to go from, forgive me if I don't have the numbers right, but something about 10,000 to about 120,000 a year, which even for,
You're 50% off. It's more
really?
than $250,000
Wow.
a year, $900 a day. In fact, that reminds me, I think my bag is in the green room, and I've got 6 days of pills in there, so somebody keep an eye on that, because that's $5,400 in there. I shouldn't have said anything that loud.
So again, you're a patient,
Yes.
you're a consumer, you're at the mercy of your insurance company. And again, tell me what you had to do to get this drug at a reasonable price, or to get it when you needed to travel.
Yeah, so unfortunately, we have no say in how much something costs, right, or what we're going to pay for it. That's all decided up here. And amazing that I can avoid radiation and chemotherapy, which is the standard of care for a grade 2 astrocytoma, because this just got approved by the FDA. So my surgery was in December of 2024. In August of 2024, this medicine got approved. And not for gliomas, for grade 2 astrocytomas, exactly what I had, right? And I grew up, I went to Catholic school Monday through Friday, and I went to Hindu temple on Sunday, right? That was just, my parents wanted the discipline of sisters being able to hit me with a ruler if I did something wrong, but they also wanted me to learn about Rama and Krishna on Sunday. So I was just a confused kid. But at that point, thinking about the fact that the pill that might keep me alive for decades longer than the normal life expectancy of 10 years happened to be FDA approved 2 months, 3 months before I needed it. It was like, I don't know if it's Jesus or Krishna up there, but somebody's got a plan for me, right? I mean, that's literally what was going through my mind. But yeah, so when I got prescribed that medicine, 6 weeks post-op, when I'm ready to start treatment for it, I find out that the price is $250,000 a year, and totally on pins and needles, just not even knowing if this was going to be covered by my insurance because it just got approved by the FDA, and everybody in this room knows how this works. Just because it's approved doesn't necessarily mean it's covered. The opinion of the FDA can be very different than the opinion of an insurance company that says, this is still kind of experimental, we're not covering that yet, even though it's FDA approved. And I see this on a weekly basis for my own patients, right? Trying to get approval to get them something that the insurance company may not cover. And yet, luckily, it was covered after deductible. But then the other drama of how much? 10 days of pills were mailed to me each time. And this is as president-elect. Mm-hmm. And within a matter of months, I was traveling again. And now one of those trips is to the World Medical Association. And this one happened to be in Uruguay. And that's like a 15-day trip. And I've got less than 10 days of pills. And biologically speaking, this thing's probably not going to grow at all just because I missed my pill for 5 days. But as a patient, it's potentially devastating, right? Like my wife is begging the insurance company to give us just an extra 5 days just in case something happens. Didn't happen. Like she's in tears as I'm going to the airport because there's going to be 5 days where I don't have my anti-tumor pill.
And she's spending hours and hours on the phone.
Oh, yeah. Oh, my gosh. I mean, she's a physician, too. She's an OBGYN. We come home. I'm doing prep for my next AMA speech at that time. And, of course, I had recovered and whole story there about whether or not I was going to make it, let alone be able to speak. I went to speech therapy to be able to speak and read. But, after that part of it, I'm traveling, and she's having to be my Florence Nightingale, right? She's an OBGYN by day, and she's a patient caregiver still to this day. Because when I hit the road and she has to navigate, my MRI scan that I get every 3 months now, used to be every month, figuring out, do I have prior authorization for that, right? That's exactly what she has to deal with. And, being physicians, we know that needs to be done, and I don't think anyone's closer to their patient than their doctor, right? We know exactly. When I walk out of that exam room and I need to get a PET scan for a patient that has a head and neck cancer, I know what a pain in the neck that sounded goofy. A neck cancer is a pain in the neck. But I'm going to write that down. That's kind of funny. Yeah. But I know what kind of pain in the neck that's going to be. But then having to be the potential victim of that, mm-hmm. as opposed to the person that's helping that victim, oh man, that was an eye-opener, for sure.
And how did you end up getting the pills, those extra pills?
I didn't.
No.
Oh.
Didn't you have to call a friend?
Oh, yes. Yeah. So that was. So now fast forward, that was that was January of 25, like the first month afterward when I started this pill. Now rewind the tape just 4 months, so January of 2026. New year, new deductible, new everything when it comes to insurance, right? And now all of a sudden we're trying to get the next supply. And on the other side of the phone, the insurance company says, well, we don't have approval for it, we're not going to cover it, and we're doing the math, $30,000, right, that we had to figure out, what are we going to do? And again, hours, days, going through the pyramid or the ladder of an insurance company to get to the person that might be able to do something, totally didn't accomplish anything, right? My wife, again, crying, because, sure, we could probably figure out how to get $30,000 to write a check and have it not bounce to be able to get this pill. But I have health insurance, right? We've been paying deductible, pretty high deductible nowadays too, and yet this is what we're dealing with. And again, I was about to leave town, and she's literally in tears at the same exact spot. She works in one spot in the kitchen. This is her desk. The same exact thing we had to deal with all year long, and here she is again as I'm about to go to the airport. And I hated doing this because it's just not how things should be. But I texted the chief medical officer at Blue Cross Blue Shield of Michigan, who happens to be an anesthesiologist that I've known, that is the chair of the Michigan delegation to the American Medical Association, right? Like he's family. I shouldn't have to call somebody like that to solve this problem. But I texted him because I didn't want Nita to be suffering, panicking while I'm gone. Within 15 minutes, problem solved. 15 minutes. There was some issue with the prior authorization not having gone through to the dispensing company to be able to mail me the stuff, that in the ladder of the healthcare insurance company, of who's picking up the phone, I mean, I don't know. I don't even know what building it's in, whether it's in this country at all. I don't know. But it didn't go up the ladder the way it needed to, which I don't think it ever does, right? Again, being a physician, I know what it's like. My office staff navigates that ladder every day, 10 times a day, and it never goes easily. And yet, because I know this person, I have exactly what I need. And that's, again, somebody up there, this isn't coincidence that the guy who's going to be, for a year, the president of the AMA, talking about our entire healthcare system and what needs to improve, is a victim of that system, theoretically, but has a unique way out. So everything from access to care to prior authorization to health equity, right? To be in Flint, Michigan, where nobody, and we live in the city of Flint, where nobody has access to care at that level, let alone, you could be in Beverly Hills and not have that kind of access, right? That's the kind of privilege I have. That I talk about the gap in healthcare in our country and where I am and where the average is and where those that truly suffer are. And in my lifetime, I don't see that gap closing, but man, we got to make it smaller.
You talk about the tumor wisdom you gained. It's such a sort of terrible and beautiful phrase at the same time, but can you tell us about some of the tumor wisdom?
Yeah, a lot of it was about the healthcare system, but there was a lot of it that, again, when you're a patient, just the thought that you're in as a patient instead of a doctor is very different. Again, I don't think anyone's closer to a patient than their doctor, but just the mental health of my patients. I never used to think about that, right? I was, again, a little bit too much like Spock, not enough like Kirk, not emotional enough when I'm in that exam room talking to my patients about, that biopsy, we got the results. It's a squamous cell carcinoma with a N1 lymph node, so this is stage 2. If you quit smoking and we get you plugged into radiation and chemo to start right away, your survival rate's going to be close to 80%. That's exactly the way I talk. And now I can't help but thinking, dude, you're a dumbass to not connect emotionally even a little with somebody that's listening to that on the other side. And so it was like a wake-up call. And I can honestly say now, because I've been back in practice now for a year and a half, that I'm a different guy. In that I take the time and have not just the facts, but the connection. And then even other things, like I had the privilege of being in that room with Ian Parney and the neuro-oncologist, Dr. Center, with my entire family. If I'm in the city of Flint and I'm a single parent and I got to drop my kids off at school, if I have a car, a lot of my patients take the city bus, and then I come to this appointment to see somebody like me by myself with nobody to let alone take the notes on what to expect, let alone be emotionally connected. That person's there with both of those responsibilities or both of those duties. That's impossible, right? We're not superhuman.
Yeah.
And I never thought about that. And so now, when I've got something to say to somebody that's going to be hard, we actually say, is anyone coming with you? Who would you like us to put at least on a Zoom call so that they can at least listen instead of you having to be, remember the facts and get over the emotion? Yeah, so I've matured a lot. The brain tumor causes maturity, go figure.
And, hopefully that drug is working away and you've got lots of time, but I think you're thinking about your time might be finite, and what do you need to get done in that time? And if you could talk about the teaching.
Yeah, so this was something that again, if you Google grade 2 astrocytoma, life expectancy is 10 years, right? And so let's see, in 2024, I was 53. And, people with the access to care and the lifestyle I lead expect to get to 90 something, right? And so I had a plan, right? When I'm done being AMA president, I was planning on a couple things. One, going to Washington, D.C., representing my district. The other thing that was on my mind, and I was going to do it maybe sequentially, is to teach math and or science in Flint public schools, the city that I live in the city, not suburban Flint, dealing with the water crisis, all that. That's the city of Flint. Our college readiness rate in the one high school that remains in the city of Flint, kids that actually go to college, where most of us would start with a 101 level class. The percent of kids that graduate from Flint High School that could start with a 101 level class, 4%.
Oh my gosh.
96% have to take some remedial classes. And so my plan was to do otolaryngology in the morning and teach math and or science in Flint Central High School. When, if I did something in Washington, D.C., then when that gets boring or I don't get elected, then maybe do this or planning on doing this.
Yeah.
But now if all that's 10 years, it's not sequential anymore. It's one or the other. And then what sort of convinced me of which of these things I was going to do was just looking at the nature of trying to accomplish things and do amazing things in Washington, D.C. It's more luck than it is skill.
Yeah.
It seems. As far as timing and who happens to be the party with power relative to your goals as an individual. I mean, just not something that I was optimistic about.
Yeah.
And so the impact on our country doing that, and I have enormous respect for the people that take that risk and try to do that, versus the impact of helping 1 or 2 kids in Flint, Michigan per year accomplish their dream of going to college and the entire future, not just for them, but their whole family, right? Who, 50% of our patient population is on Medicaid, right? What is the future for that family? But now you get a kid with brilliance that goes this different path and maybe even becomes a doctor.
Yeah.
The impact of that versus being a drop in the ocean in Washington, D.C., at least my perspective, that was an easy decision.
Yeah.
So that's my plan.
That's amazing. Well, you brought up Washington, so I know you were there recently at the unveiling of the new food pyramid. Mm-hmm. And I know you surprisingly felt like you had some things in common with our new secretary. We've spent a lot of time at the conference talking about him and his impact. But tell me how you're navigating that. I know some of your membership were very upset that you were even in the same room. I know some probably were thrilled. How are you navigating, how did you navigate that event, and then in general this political turmoil that we're facing, that medicine and health is so caught up in?
Yep. So that was it was an amazing experience for me. I was like a deer in headlights. I'd seen Washington, D.C., and I've seen the White House from the street, on the outside part of that fence, and now here I am going through security. And then once you're through that second security, it's like you can walk wherever you want. And so I'm kind of looking around and I see this door. It looks like the door I'm supposed to go through. And sure enough, that's where the press conference and the press room at the White House was going to be about the dietary guidelines. And the reason I was there was that I have a passion, the AMA has a passion for improving the health of our country. Diet and nutrition, I think, is a very underappreciated way. And not enough investment in helping with that. And instead an investment in taking care of disease when it happens. That's why I got my lifestyle medicine board certification, actually, because that's a passion of mine. And so here was an opportunity to talk about why education, AMA's responsibility when it comes to educating doctors, about the diet and nutrition and the role that it had on impact on our health. And so I was excited to be there. But again, as soon as I walked in, I was like, whoa, this is the White House. And I'm in the front row because we're participating in this. And this was also, I think, the day that Venezuela was in the news big time that day. And so that was all going on also in the White House. Like, you go this way and you go to the Oval Office, you go this way, you go to the press room, and that's where I went, obviously. And Secretary Kennedy got up there, and it was a whole revealing of this. And at that moment, it was two potential ways that could go. Clearly, at the beginning, when Secretary Kennedy was approved to be head of HHS, there was a lot of tension there, as expected, about vaccinations. The AMA, very vocal about the role of vaccinations in preserving our health and avoiding everything from pandemics to measles, and knew that was going to be a conflict there. And I didn't know what to expect. And so I'm sitting here, and he's up on stage right there. As soon as the press conference was done, he starts walking towards this front row. And I thought there was a reporter next to me that asked the first question, and I thought he was just coming to talk to her. He comes right up to me, he says, "Thank you so much for being here." I totally didn't expect that. Right? I mean, in the speech, yes, thank you to the AMA for working with us on this, the standard thing you would say in front of a microphone. But no microphone, no camera, and he's coming to thank me for working with him on this. And I was pleasantly surprised. Then the whole press conference shifts to talking about Venezuela, so we go backstage. And we're in this room, and I was just talking without rehearsal, and I kind of said, Secretary Kennedy, I know that we don't see eye to eye on vaccinations. And, I understand that, but I'm very glad that we're working together on these dietary guidelines and improving the health of our country by helping people understand what it is they're eating, making sure that there isn't going to be stuff in there that's going to addict them to eating this. Looking forward to working with you together on this. And the other thing I said, I don't even know, it's probably stupid, but I said, and if we're getting along well, and we're having dinner, and we're having a conversation, and we start talking about vaccinations, I'm looking forward to that too, but for now, we'll focus on this. And he said, sounds good to me. The next day, there's a quote in the Wall Street Journal after this big unveiling, and he says, we disagree, he's talking about me, we disagree on vaccinations, but on this we agree, and Dr. Mukkamala, or Bobby Mukkamala, is a good guy. This is like a 60-second interaction, and that's when I realized that we're all going to disagree about something. I get together with my friends on a Friday night, fellow physicians, and man, the blood's boiling within an hour disagreeing on this, that, and the other, but Saturday morning, we're getting along fine. Right? That's a productive relationship to improve things. And so to disagree on one thing, but to work on something else that could potentially lead to a conversation about something that's even more intense is, I think, the best way to do things. Yeah. And that's, so far, how things are working.
Yeah. Great. I have one last question, but I'm in a room full of amazing journalists, so please go to the microphones if you have questions. So my last question is, you obviously are bringing a lot of urgency to the issue of healthcare access, health equity on a personal level. What can the AMA do? Are you bringing that urgency to the organization? And these issues are so pressing. What can be sped up? What are your priorities?
Oh yeah, it's definitely at the AMA. I mean, this is something that I would say, I don't know, I come up with stupid things. Sometimes they're genius, sometimes they're stupid. This is in the DNA of the AMA. So that's good enough for a bumper sticker. I'm going to make that one. But this is in the DNA of the AMA, right? Health equity is something that we've worked on for a long time, continue to work on. And so what is the influence of this experience? There's data about a lack of health equity. That's the white papers that come from universities. And then there's the stories about health equity. And I think both are important, especially in the era of social media, right? Where it's not going to be a white paper that conveys what we want people to know about the impact of this, that, or the other. It's going to be the 15-second Instagram thing, right? And I think that's what's important, to be able to convey just the stories of access to care where it's lacking, to demonstrate what we need to improve. And so that's been an amazing evolution of the things we can do to pursue the passions that we have, the goals that we have, just to, again, close that gap in access to care.
Okay. All right. Our first question from President Gideon Gill of the board.
Thank you so much for being here, Bobby.
Thank you.
I wanted to ask you, when you get the chance to talk to Secretary Kennedy, what are you going to say to him about vaccines?
Well, it's a good question. He knows what the AMA's, how important that is to the AMA. And what I'm going to say is, I want to know why it is you have, and he's not unique in that, right? I mean, I have 5,000 Facebook friends, the max, and this was all before all this, even before COVID. And now I know that literally my 5,000 Facebook friends, 50-50 on whether or not we should even get vaccinated for COVID. 50-50. So he's not unique in his opinion, right? And so the same thing I say to my friends that are in the other side of that 50-50 for me is, hey, what do you think that? What did you read, right? What story have you heard? And that's exactly what I would want to know about somebody like Secretary Kennedy. Why is it that you think what you think? Was it an experience that you had? Was it somebody that you knew that had some reaction that you think was related to this that made you think about this? Like, what is same thing about COVID. When we vaccinated 5,000 people in a weekend in our hospital parking lot, in our airport parking lot, and then there was the other 50% that we needed to have one-on-one conversations about what mRNA is, what DNA is, what's the difference, answering their questions, hearing what their concern was. That's exactly what I would do.
Thank you. Next question.
Yep. Hi. Thank you so much for being here. My name is Emily Watkins. I cover disability for an NPR station. I'm one of a few reporters across the country that cover disability as a specific beat. And I also grew up with a disabled parent on SSDI, and I'm disabled myself. And what really stuck out to me about your story, which I'm really grateful for you sharing here, is not necessarily that you called other doctors when this happened, because I would not expect you to not have other doctors in your network, but it's the self-advocacy that you talk about in your story and that your wife does for you. I think so many disabled Americans, that's something that really resonates with us, and there's a whole movement within disability of just teaching those self-advocacy skills, knowing how to take notes, communicate with your doctor, navigate portals. And I think that sometimes people in the disability community face pushback from providers when that advocacy is too strong, or they don't get the care they need because they don't know how to self-advocate. So I guess I'm interested in, like, what do you see as the AMA's role, or what could be the AMA's role in creating a new culture of self-advocacy between providers and patients?
Yeah, this is something that is very important to the American Medical Association. Not just with that example, which is a perfect example, but there is so much that we want to see happen in our healthcare system that when we are the only voice, it's predictable what the opinion of the AMA is on X, Y, or Z. But so much of it, like prior authorization, affects patients. And so how to get them engaged. We literally have a database of hundreds of thousands of patients that when there's an issue that needs their attention, that deserves their attention, that they will benefit from giving it attention, it's activated, right, on exactly this kind of issue. And so this is another example of when we would say, this is something that we need to solve. There's legislation pending to be able to fund something like that, so people with a disability, people that just are having trouble navigating the system, the funding, a drop of the $5 trillion we spend on healthcare needs to be invested in that. If there's a solution for that, and we are advocating for it, but we need to add the voice of patients, we activate it because it accomplishes so much more.
Thank you.
Thank you.
I'm going to go here, and then back. So go ahead, please.
Hi, Doctor. We chatted earlier today, but I'm Simon Levine at Politico. I cover doctors and providers. We talked a lot about health equity, health access in this conversation just now, but I'm really curious about where the issue of Medicare pay for doctors, which has been declining for many years, now ranks among the AMA's priorities. And the reason I ask is because it's been at the top of the list for the AMA and for so many doctors for, I think, decades now, right? Yep. And as the AMA has become more and more vocal against the Trump administration's vaccine policy and drawdowns of research funding, right, I wonder how the Medicare reimbursement issue stacks up.
Yeah. One, I would say that the AMA can walk and chew gum at the same time, right? And so we have a lot of things that we work on. It's not one thing that's going to be it this year. Now, that being said, you know, of our recovery plan for America's healthcare system, Medicare reimbursement to physicians is at the top of that list. And why? You know, again, there's the white paper explanation, and then there's the frontline, boots on the ground explanation. That's the one I'm going to give you. So Nita and I share an office. This is the 26th year. We moved back to Flint in 2000 and opened this practice. In 2000, our office staff, about $10 an hour. Now it's like $25 an hour, right? Rent, the stuff that Nita injects on the OBGYN side of the office, the stuff I use on the ENT side of the office, all of that increased cost to give the best care we can to our community. And then you look at what Medicare compensates us, right? Which is kind of the main basis on which all insurance companies reimburse us, right? Some percentage of Medicare. If we're lucky, 120% of Medicare, sometimes 90% of Medicare. Where Medicare goes, all the other ones follow. A 33% gap between what inflation has done and what Medicare compensates. And what is the consequence of that, right? It means, like the microscope that I use to look in people's ears. You know when I bought that thing? Before Facebook Marketplace, before Craigslist, before eBay, in the paper classified ads when I finished my residency in Chicago that I picked up in Indiana on the way back to Flint. That's the scope I still have. Why? Not because there's not stuff available, but that's a big investment. And if this one's working for me, yes, it's not perfect. I got to change the bulb every 2 weeks instead of LED where I don't have to change it at all, but I'm still doing it because the finances are difficult, right? That's a responsibility of our healthcare system. And where Medicare goes, everybody follows. That's exactly why we just want them to link it to the cost of running our practices, just like hospitals get, right? Costs go up, compensation goes up, right? Let it follow an index. There's a whole index for that, the Medicare Economic Index. So there is a solution that we've been fighting for a long time. And then the other thing, the intersection with what I said earlier, if we want to keep America healthy, let's keep them out of the hospital. How does that happen? A wonderful outpatient experience, time to take care of everybody, resources to take care of everybody. That should be easy to accomplish.
Thank you.
Thanks.
Joanne?
Hi, I'm Joanne Kennan. I'm the journalist in residence at the Johns Hopkins Bloomberg School of Public Health. And
I'm sorry, I got a quick story about Johns Hopkins, real fast, I'm sorry. So my dad came, he wanted to be in this country. He thought he wanted to be a radiologist, so he applies. This is before match. He gets 2 job offers. He ends up in Flint, Michigan because it pays $400 more than some place called Johns Hopkins Hospital in Baltimore. He had no idea, but one was $400 more per year. Sorry.
And the hospital probably pays better than the public health school.
For sure.
And I read a book, this book came out a few months ago called Information Sick, and it's about how the demise of journalism and the rise of disinformation is harming our health institutionally and as individuals access to information. Doctors cannot solve the information crisis single-handedly because you've lost the trust of people who won't walk in, and there are millions in this country who still don't have access. To the extent that you are, even your patients who are being bombarded like nonstop with all this confusing garbage, what is the AMA doing to empower clinicians to, the people who walk in still do trust you, by and large, or they wouldn't be there. How do you build on that? How are you teaching people how to communicate? Are you teaching them the science of disinformation? We're in a really bad place. So what is the AMA trying to do? And I'm not saying you created it, but the solutions, I don't know what the solution is, and I wrote a book, but what do you think? What is your role?
Yeah, I think that, I don't think that my physician friends in their offices need personal help trying to have that conversation. We need time.
15 minutes, right.
So those are the kind of things. We need the environment to support that conversation. Not that there's a knowledge lack that we need to be able to do this. Some of it's style, like being more like Kirk than Spock. I could take that class for sure. But the other thing that we do at this level, not just the individual level, is that Nita and I live in a 106-year-old house in Flint, Michigan, that used to have, help that lived there. So where the housekeeper lived is now my studio in my home that's got amazing lighting, an amazing camera. Why? So that when I am out there sharing information that isn't disinformation, but good information, I actually have good lighting. I've actually got a little makeup kit to decrease my face and comb my hair right next to it. Too much information, I know, sorry. But the reason is that if you want to have appeal where people are going for information, they have to get over that first few seconds of, who's this guy? What is he saying? Where is he? What's the lighting like? If it looks bad, if there's data about this, they're not even going to get to the point I'm trying to make. And so, yes, this is our solution. One part of the solution to deal with disinformation is give them the right information in a way that they can get it the way they want, not a white paper, but a 15-second video from a person that they actually might be able to trust because they've heard that person before, and the audio is good, and the lighting is good, and they're not going to click to the next page on their phone.
Okay, thank you. That's great. Question on this side?
Hi, I'm Teresa Wilson, independent journalist from the Central Coast of California. I'm right on the coast, equidistant between San Francisco and Los Angeles. Not exactly rural, but we are a medical desert. You talk about wanting to teach in your local underserved high schools. Are there any things that the AMA and other organizations are doing to partner with colleges and medical schools to provide free tuition for qualified students so that they can train and then maybe for contract go back and work in those underserved areas?
Yep. So the AMA is doing a ton on that, but it's not with a checkbook, right? Because relative to that problem, we are a drop in the ocean, right? So it's not the sky. We have our entire foundation. But again, the people we help to do exactly what you want, like what you asked for there, which is the right ask, is minimal relative to the advocacy work that we can do. So a ton of my media assignments in that studio I talked about now is the problem with a $200,000 cap on loans for a medical degree. Right? The average debt is $300,000 at a public school, $500,000 at a private school. And so those are exactly the kind of things that we're very vocal about to go back to how it was before this change, which is cover the cost of getting a medical education. Yes, there are things that should be looked into, like why does the tuition keep going up every year? What are we getting for that? That's the solution they were trying to get at, but hurting the students. And so this is something that the AMA is very vocal about. Right? And the other aspect of it is the investment in rural and underserved areas. So we have a project called West Side United, the west side of Chicago. Relative to the Loop in Chicago, it's like being in a third world country as far as access. Not even being able to find an OBGYN when you go into labor, having to get in a bus to go somewhere else. Like that's the kind of stuff we're working on with a project like West Side United. Not that we can afford to replicate that in every underserved area, but to prove that when we invest in a community's health, not just in the intersection with the doctor for 15 minutes in the office or an hour in the operating room, but everything that led to that and everything that follows that, that's what we're trying to prove. And that's with places like Rush University, right, where everybody gets involved in taking care of their community to avoid that kind of problem that you're experiencing there.
Thank you.
Thank you.
This side?
Hi, I'm Kevin Ritter with AHCJ, and it was really fascinating hearing your story and what you learned from your experience on the patient side of as a cancer patient in the medical system. You said that while you shouldn't have had to use your network to finally get care, that's eventually what you had to do. So I was just curious to hear what your plan to do as president of the AMA to help less privileged Americans get the same necessary life-saving care on like a reasonably fast timeline.
Yep. So, I mean, there's so many benefits that I had right? Like being able to go, we have a physician shortage in this country. We're going to be almost 90,000 physicians short within the next decade. We're working on that, right? Trying to increase the number of residency positions, allow international medical graduates to come without having to come up with $100,000. I mean, there's multiple solutions for just that problem. And then prior authorization, right? We're working hard on that. There's so many aspects that I had access to that we need to work on for the whole country that are priorities of the American Medical Association. So it's one of these things that there's not going to be a magic solution for all of them. They all need attention in different ways. Sometimes it's litigation. Sometimes it's policy from Washington, D.C., right? Sometimes it's funding for training more physicians, for student loans, right, to get more people to provide this care. These are all the aspects of how we will fix the healthcare setting that we're in now. But it's not going to be like I said, not a one-size-fits-all thing. Some of it's achievable. This is what I also tell those that we're trying to bring into AMA membership, right? We have 1 million physicians in this country. A fraction of them are members of the AMA. What I tell them is that if you want to solve these issues, join us to add to the voice of physicians so that we can go through each of these potential solutions and be successful.
Thank you. Okay, our last question on this side, please.
Hi, I'm Elaine Grant, and I'm an independent audio producer doing work for This American Life and NPR, and I'm doing a lot on rural health, and I'm pretty horrified watching, sort of the train wreck that's happening. I live in Maine, and as the Medicaid cuts, really take effect following the midterms, it seems like we're going to be watching hospitals drop like flies, labor and delivery, and when I talk to people out in rural areas, they're just completely at a loss, including doctors at a loss, as to how on earth people are not going to die. Yep. And I'm curious what you and the AMA are watching, thinking, worrying about for not just now, but in after the midterms. And are there ways that you are looking at trying to keep it from getting, let alone solve the problem, try to keep it from getting as bad as it is looking like it could be?
Yeah, for sure. I mean, this is something that we've been talking about since the moment it was being considered to the moment it passed with the One Big Beautiful Bill Act, knowing that after the midterms, the consequences are going to start to be felt. 10 million people losing health insurance, losing Medicaid. Even those that are able to keep it every 6 months, having to go and explain why it is that they're still qualified, right? And the examples that I use are, I see people all the time that have an early cancer, stage 1 cancer. And like I said, 50% of my community is on Medicaid. If somebody gets dropped, they're going to just be psychologically, they're going to be like, you know what, maybe it's not that big a deal. I don't have insurance anymore. Why don't I just see what happens? Well, you know how that becomes. It becomes the normal approach. They don't notice it growing, and then they come in with a stage 3 cancer instead of a stage 1 cancer because it started bleeding, not because they finally said, okay, I don't have insurance, but I'm going to go pay $100, I'm going to go in. No, that's not going to happen. It's going to start bleeding. They're going to start aspirating. They're going to end up in the emergency room, and then I get called, and of course I'm going to go in to save this guy's life. But what is the cost of that? One, you've changed somebody's life expectancy. That should be enough right there to say we shouldn't do that. But now the hospital has me in the operating room with no insurance. So that's like it was before the Affordable Care Act, right? When so many people didn't have health insurance. And now we're going that way again. And then I get up at 2 in the morning to do a tracheostomy and save this guy's life, totally uncompensated, right? We have a moral attachment to doing that, right? But the system needs to support that so it's not a unique experience for that patient to survive. Nobody should have to go through that. So what is the AMA doing about it? Much of it, like you said, damage control, right? In a matter of months, this is going to be reality. And yes, maybe that can get fixed where it started, but until then, states like Michigan are going to need help saying, how do we protect our patients' lives and their health given this headwind. And that's exactly where the AMA is involved, helping every state.
Thank you so much, Doctor.
you.
Thanks for all the great questions. It's been such a
Thank you.
delight. Yeah.
Thank you.